First, the Target 12 Investigators exclusive.
Providence police officers were called to more mental health incidents in 2020 than any time in the past 4 years.
The pandemic threw things amok. We're hoping some of these are an aberration, an anomaly.
Despite the alarming uptick in these mental health calls for help, the head of the Providence Police Department says some critical funding to deal with these incidents is set to expire.
Target 12 investigator Tim White is here now with his exclusive findings.
The video you're about to see is body-worn camera footage obtained from Providence Police. It's a vivid illustration of what officers tell me they are experiencing with disturbing frequency. August 2019. Providence Police respond to a call for a person threatening to jump off the Henderson Bridge.
What's going on?
Video from police body-worn cameras show Providence Patrolmen Frank Moody and Tony Hampton attempting to connect with the individual in distress.
Nothing's that bad we can't talk it, all right? Listen, what's your name? My name's Frank Moody.
Then, after several minutes of trying to talk the person down, the officers act quickly, lunging and pulling the individual to safety.
You're good. You're good, okay? You okay, bro? You're good. You're good.
That incident was just before the pandemic struck, and calls to police for mental health intervention have been on the rise ever since.
People felt a lot of anxiety, a lot of depression.
Providence Police Colonel Hugh Clement says 2020 was unfortunately a big year for mental health incidents, or MHIs. A Target 12 review of police data found there were 230 MHI calls in 2017, 177 in 2018, 201 in 2019, then a spike, 339 in 2020.
And their loved ones and friends, when they saw someone in the midst of an episode of behavioral health issue, they didn't know who to call. So who would they call? The most visible face of government, their police department.
Clement says they partner with the Providence Center, working with a clinician to respond to MHI calls when they come in, but resources are thin.
So we have 2 clinicians, one for the day shift, one for the 3 to 11 shift.
But just to be clear, that's one for each shift.
It's one for each shift, so they're in one patrol car.
The clinicians are paid through grant funding, but that money is set to expire.
During this time when we have the greatest need, ironically, those grants are ready to run out.
Clemens tells me he has been meeting with the federal delegation and the courts to secure more funding. Now, if you or someone you know are in immediate need of mental health intervention, I want to give you 2 numbers. The Providence Center's 24-hour emergency line is 401-274-7111, or Butler Hospital's call center at 844-401-0111. We also have these numbers on WPRI.com. With the Target 12 investigators, Tim White, 12 News.